Let's be honest, have you ever plugged your symptoms into a search engine? Of course you have, we all have. But what happens when that search engine is a powerful AI and it spits out advice that goes directly against what your doctor told you? Well, that's the brand new, kind of tricky frontier we're exploring today. How patients are starting to use AI and how all of us can navigate it wisely.
Just imagine you're a doctor. A patient comes in, holds up their phone, and shows you that exact sentence. Wow. That one moment right there captures this huge new challenge in medicine. It's a clash between incredibly powerful technology and that very personal trust between a doctor and a patient. So what's the right way to handle that? How do you even begin?
So here's how we're going to break it all down. First, we'll look at a hypothetical case of an AI second opinion. Then we'll dig into the big question. Does this lead to a confrontation or a collaboration? From there, we'll talk about a new kind of partnership. Then go through a super important user manual for medical AI. We'll also cover how to frame questions, not demands, and we'll wrap up with the most critical point of all: data is not the same thing as care.
Okay, so to really get a feel for how this plays out, let's just walk through a hypothetical, but believe me, a very plausible case.
So picture this. We've got a 57-year-old guy who's been managing his type 2 diabetes for a while. One day, he gets curious, He uploads his medical records into one of those publicly available AIs. The AI crunches the numbers and suggests a treatment plan that is completely different from his doctor's advice. So now, he's walking into his next appointment not really for a checkup, but for a showdown, armed with what he thinks is a smarter, better opinion. This is the new reality we all need to figure out.
And that scenario right there brings us straight to the heart of the dilemma. What does that conversation in the doctor's office become? Is it going to be a fight, or can it actually become a collaboration?
This is really the essential question we have to answer. How can you, as a patient, take this amazing new tool and use it to be a better advocate for your own health, all while making the trust you have with your doctor stronger, not shattering it?
Now, the good news is there's absolutely a path forward. And it's not about choosing the AI or the doctor. It's really about completely reframing the whole relationship. The best solution is to think of it as a three-way partnership. It works like this. The AI's job is to be a super powerful tool for spotting patterns in data. That's what it's good at. Your job, as the patient, is to bring the human context, your goals, your lifestyle, what you're actually feeling. And then, the doctor's role is to take all of that, apply their years of clinical judgment and expertise, and put together a care plan that's both safe and effective for you.
But for that partnership to actually work, you have to understand the tool you're using. So let's run through a quick user manual for medical AI. Think of it as the instruction booklet.
This first point is absolutely crucial. You have to get the fundamental difference here. An AI, at its core, predicts. It's basically a gigantic, complex system for guessing the next most likely word in a sentence. It doesn't actually understand biology. A doctor, on the other hand, practices medicine. They use their knowledge of your body, of biology, of chemistry, to figure out what's really going on.
Okay, and you really need to listen to this next one. You have got to be aware of something called an AI hallucination. This is when an AI just makes stuff up, but it presents that false information so confidently as if it's a proven fact. It might cite a medical study that sounds totally legit, but it just doesn't exist. And the real danger is, it says the lie with the same authority as it tells the truth, which is incredibly misleading.
And that leads to these other key risks. First, an AI has zero clinical judgment. It can't understand nuance. Second, it can't give you a physical exam. It can't listen to your lungs or see how you look. Third, it completely misses your emotional state, which is a huge part of your health. And finally, let's not forget the huge privacy risks when you're uploading your most sensitive health data to these systems.
And please be on the lookout for these massive red flags for medical scams. If any AI tool claims a 100% cure rate, or tells you to just stop taking your medication, or pushes unverified supplements, or creates this false sense of urgency, or asks for payment in crypto, just run. These are all huge warning signs.
So, now that we get the tool's limits, how do we actually bring this info to our doctor? Well, the key, it turns out, is all in the approach.
And this slide just perfectly illustrates the difference. The wrong way is a demand. My AI says you're wrong, right? It's confrontational, it just shuts down the conversation. But the right approach is a collaborative question. Hey, I was looking at this AI, and it mentioned an alternative. Could you help me understand if or how that might apply to my situation? See the difference? One is an attack. The other is an invitation for your doctor to share their expertise with you.
All of this brings us to our final and maybe the most important point of all.
and that is the irreplaceable human element in medicine.
At the end of the day, here's the crucial takeaway. Data is just information. Care is a human act. An AI can process endless amounts of data, but real medicine requires empathy, and it requires ethics. These are qualities an algorithm just can't provide. So by all means, use AI as a tool. Use it to ask better questions, to be a more informed partner in your own health. But please, never forget that true healing relies on the wisdom, the judgment, and the human connection that only your doctor can offer.